Today we're going to be talking about the vertebral column, also known as the spine. So let's begin. The vertebral column protects your spinal cord, which is part of the CNS. It's made out of individual bones called vertebra, and the plural form of vertebra is vertebrae. The vertebral column, it becomes larger and heavier as you move down, so it can handle the weight of the body. So the vertebral column, as you can see here, this entire thing is the vertebral column. It consists of 4 separate vertebrae, 7 cervical vertebrae, 12 thoracic, and 5 lumbar. So these individual vertebrae, which are 24 vertebrae, plus the sacrum and coccyx, which are made of fused vertebrae. The sacrum is made up of 5 fused vertebrae, and the coccyx is made up of 4 fused vertebrae. So in total, you have 33 vertebrae. 24 are separate, and then 9 of them are fused, which include the sacrum and the coccyx. Okay, so let's talk about features of a typical vertebra. Let's just identify some of the key parts you have to know. So here we have the pedicle. This is the lamina right here. And then you have the transverse process. Oh, sorry, this is the spinous process, the transverse process. This is the vertebral body, or the body of the vertebra. And right here, this thing is called the vertebral foramen. So let's talk about a few other processes that are present in the in vertebra. Here we have the superior articular process, and this smooth surface, is called the superior articular facet. And then here we have the inferior articular process, and this smooth surface is called the inferior articular facet. And so you can see here, this part right here is the inferior articular process of this vertebra, right here. And this part over here is the superior articular process of this vertebra over here. And so they form a joint called the zygapophyseal joint. And then when the joint forms, when they articulate together, spaces form. Here and here and here, spaces form called the intervertebral foramina. So these spaces called the intervertebral foramina form when the vertebral bodies articulate with each other, and from the intervertebral foramina, the spinal nerves emerge from the spinal cord. Okay, so here we have an intervertebral foramen. Foramina is the plural, and you can see this is the spinal nerve. It emerges. Okay, so let's talk about typical cervical vertebrae. So we're going to start with cervical. Actually, before I start, so the cervical vertebrae are in the neck region, so right here. And then the thoracic vertebrae are in the chest region. And they're very special because they actually articulate with ribs, as you can see. And then the lumbar vertebrae are in the lower back region, right here. And then the sacrum is in the pelvic region. The sacrum and the coccyx are in the pelvic region. So now we're going to talk about the typical cervical vertebrae. By typical, we mean that these vertebrae that we're going to talk about share the same features. So C3 to C6 are typical. That C3 refers to the third cervical vertebra. C6 refers to the sixth. So C3, C4, C5, and C6 cervical vertebrae are typical, and they share the same features. Their spinous process are bifid. That means it's divided. You can see right here. And there's presence of something called the transverse foramen. Right here, this is the transverse foramen in the transverse process. And a few structures pass through the transverse foramen. like for example, the vertebral artery, which goes up to supply the brain and the spinal cord. So the transverse foramen is only present in the cervical vertebrae. It's not present in the other regions of the vertebrae, and we're going to talk about the other regions now. But before that, we're going to talk about the atypical cervical vertebrae, which include C1, called the atlas, C2, called the axis, and C7, called vertebra prominence. Okay, so let's first talk about the atlas. So it's right here. This is the atlas. As you can see, it has no body. It's kind of like a, it kind of looks like a ring, and it also has no process. It just has an anterior tubercle and a posterior tubercle. It doesn't have a spinous process. So it articulates with the occipital bone at the atlanto-occipital joint. So right here, you can see this is the occipital bone, and this is the atlas or C1. They form a joint. They form a joint over here called the atlanto-occipital joint, and this joint permits flexion and extension. Yes and no movement. So it causes this action. So right here, the joint, the atlanto-occipital joint, it allows you to extend your neck, and it allows you to flex your neck. So this is flexion, and this is extension. Okay, now let's talk about the axis, which is also atypical. It has something called the odontoid process. So right here, this is C2 axis. It has a process that projects upward called the odontoid process, or the dens. And it articulates with the atlas at the atlantoaxial joint. And this allows a no movement of the head, which is rotation of the head basically. So as you can see here, this is the axis. This is the axis, and on top of it is the atlas, C1. And you can see that the odontoid process, or the dens, it projects upward right here. And there's actually a ligament called the transverse ligament of the atlas that wraps around it like this. And so it allows the head to move from side to side, or to rotate, to make a no movement. And the joint is called the atlantoaxial joint. Okay, so let's talk about another atypical vertebra called C7, or the vertebra prominence. It has a long spinous process that is not bifid. So all the other cervical vertebrae are bifid. That means it's divided, except for C7. Its spinous process is not divided. And this vertebra is very important because it's actually used as a landmark. So it's felt and through the skin. It's felt and seen through the skin. It's right here. And you can use it to count other vertebrae. So after C7, you have T1, the first thoracic vertebra, and before it, you have C6. So it's used as a landmark. Okay, so let's talk about thoracic vertebrae. They consist of 12 vertebrae, and they are special because they're characterized by articulation with ribs. So right here, we have thoracic vertebrae, and you can clearly see that the rib articulates with the thoracic vertebrae, and then anteriorly with the sternum. Okay, so let's talk about typical thoracic vertebrae. It has a heart-shaped body, okay, and you can also call it a triangular body. It has superior and inferior costal facets. So these structures right here, this is the superior costal facet, and this is the inferior costal facet, and this is the transverse costal facet, and this is the areas where the ribs articulate. So for example, if this was T5, rib 5 would articulate over here, okay, and then anteriorly with the sternum. Okay, so let's talk, I just mentioned it, but let's talk more about how thoracic vertebrae articulate with ribs. So let's say this is T5, the fifth thoracic vertebra. The rib is going to articulate with the superior costal facet right here. So the head of the rib 5 is going to articulate with the superior costal facet of the fifth thoracic vertebra. And then the tubercle of rib 5 is going to articulate with the transverse costal facet of T5. So basically, this is from another view, just so you can understand. Let's say this is T5. Rib 5, the head is going to articulate here at the superior costal facet. And then the tubercle, this part of the rib here, is going to articulate with the transverse costal facet of T5, like this. Okay? And then the rib that's going to be here would be rib 6. You don't need to know these details, but this is just for your understanding, and so you can understand the concept of it. But you don't need to know these details for now. Okay, so the lumbar vertebrae, they consist of 5 vertebrae. They're large in size, as you can see, very large. The transverse process is thin and long, and it has a triangular vertebral foramen. So you can see here the vertebral foramen is triangular. By the way, many vertebral foramina make up the vertebral canal. So when you stack it up together, when the vertebrae are stacked up together, they make up the vertebral canal, but individually the holes are called the vertebral foramen. And it has a large body, like I mentioned. Okay, so let's continue talking about the lumbar vertebrae. The lumbar and cervical regions of the spine have the thickest intervertebral discs. So right here, between the vertebral bodies, we have something called the intervertebral discs, which act as shock absorbers. They basically they're basically fibrocartilage that absorb your weight, so it prevents damage. So they're thickest in the cervical and the lumbar regions, and are most flexible in these areas as well. And this basically is the vertebral disc. On the outside, we have something called the annulus fibrosus, and in the inside, it's called the nucleus pulposus. And whenever you have intervertebral disc herniation, the nucleus pulposus actually comes outside and it compresses the spinal cord. So just to show you an illustration, let's say below the body is the intervertebral disc. The nucleus pulposus part of the intervertebral disc can actually come out, and the spinal cord is right here. So it can compress the spinal cord, and we call this an intervertebral disc herniation, and it causes neurological symptoms like pain in the legs or numbness, and so on. Okay, so let's compare thoracic and the lumbar vertebrae to clear up confusion. So the thoracic vertebrae are very special because they have a lot more facets than the other vertebrae. So we talked about the 4 articular facets, which are present in most of the vertebrae. But then the thoracic vertebrae are special because they have 6 costal facets. Costal means refers to the ribs. These costal facets include the superior costal facet, the inferior costal facet, so 2 on this side and 2 on the other side, that's 4. And then the transverse costal facet, 1 here and 1 on the other side, that's 2, which gives you 6. So there are 6 costal facets other than the 4 articular facets. So in total, there are 10 facets in the thoracic vertebrae. And then in the lumbar vertebrae, like we mentioned earlier, there's the superior costal facets and the inferior costal facets, and they are 4. So 2 here, and then on the other side as well. Okay, so you should not confuse the facets with the processes. Both the thoracic and the lumbar vertebrae have 7 processes. So there's the transverse process, okay, and then you have the superior articular processes and the inferior articular processes, and you also have the spinous process. So there are 7 processes in total in each vertebra. But when we talk about the facets, there are actually 10 facets in the thoracic vertebrae, like we just mentioned. So don't confuse the two. But both the thoracic and the lumbar vertebrae have 7 processes. Processes are basically projections of the bone, but the facets are the smooth surface where bone articulates, where they form the joints. And by the way, just to mention it now, this entire thing here, we call this the vertebral arch. Okay, just show you another view. This here is the vertebral arch. It includes the 7 processes: the transverse process, the spinous process, the superior articular processes, and then the inferior articular processes, which are down. Okay, so now let's talk about the sacrum. The sacrum, like I said, it consists of 5 fused vertebrae. They have something called the lateral mass, which is this right here, and it's made up of fused transverse processes. They also have anterior and posterior sacral foramina for the passage of sacral spinal nerves. So this right here are these are the anterior sacral foramina, and these here are the posterior sacral foramina. And this is where the sacral spinal nerves, they're basically spinal nerves in the sacral region. This is where they exit, as opposed to the other regions where the spinal nerves exit from the intervertebral foramina. But in the sacrum, they exit from the anterior and posterior sacral foramina. So we also have something called the sacroiliac joint, which transmits weight from the spine to the pelvis. So here, this is the sacrum, and this right here is the sacroiliac joint. It's the joint between the sacrum and a bone called the ilium. So like we mentioned earlier, this entire bone here is the pelvis. It's actually made up of 3 individual bones. One of them is called the ilium, and here, this bone is called the pubis, and the bone here is called the ischium. So the sacroiliac joint is the joint between the sacrum and the ilium, and the weight is distributed from the spine to the pelvis at this joint called the sacroiliac joint. Okay, the coccyx is made up of 4 fused vertebrae. It's basically your tailbone. Okay, so let's talk about some curvatures of the vertebral column. So right here we have something called the flexed fetal position, and we have something called primary curvatures and secondary curvatures. The primary curvatures include the thoracic and the sacral, but later on in life you develop secondary curvatures in the cervical region and in the lumbar region. We call the thoracic and the sacral curvatures primary because they're present from fetal life, and then we call the cervical and the lumbar curvatures secondary because they develop during childhood. So you can see here. This is a primary curvature, the thoracic and the sacral. They are primary curvatures because as you remember, in the flexed fetal position, the curvature was like this. So the thoracic and the sacral, they don't change. But in childhood, the cervical and lumbar develop a secondary curvature like this to allow you to walk and sit and stand and so on. So these are called secondary, while these are called primary. And the secondary are the cervical and the lumbar curvatures. Okay, so let's talk about abnormal curvatures. So let's talk first about kyphosis. It's an abnormal curvature of the vertebral column in the thoracic region. So right here we have the cervical region, and then in the thoracic region, this is an abnormal curvature where something called a hunchback deformity develops, and it's secondary to some diseases like tuberculosis. Tuberculosis, it's a bacterial infection. You probably heard of it. It's called TB. It infects the lung, but it can also spread to other parts of the body, like the spine, and cause kyphosis, for example. Lordosis, it's an abnormal curvature of the vertebral column and in the lumbar region. Okay, so this region here. It's seen mostly in pregnant women and men with pot bellies, basically large protruding bellies. Because as you can imagine, if there is a lot of weight over here, it's going to bend the spine this way and cause lordosis. Scoliosis is an abnormal lateral curvature of the vertebral column. It's so right here, this is scoliosis. There's a lateral curvature of the spine. It's commonly idiopathic, meaning it doesn't have a known cause, but it can be congenital. It can be present at birth, called congenital. So the thoracic cage. Let's talk about the thoracic cage. The thoracic cage consists of the 12 thoracic vertebrae. Okay, it also consists of the 12 ribs, and it consists of the sternum. So the thoracic vertebrae, the ribs and the sternum, make up the thoracic cage, and they protect important structures like your heart and lungs, the esophagus, trachea, and so on. Structures that are present in the thorax, the chest area. It's also a site of attachment for many muscles, like the intercostal muscles, which are important for breathing, and we'll talk more about the intercostal muscles in the musculoskeletal lectures.